Welcome back to Between Two White Coats, a podcast designed to help you be the healthiest version of yourself. I'm Dr. Michelle Plaster, a family medicine doctor.
And I'm her co-host, Amber Foster, a family nurse practitioner. In our combined 30 years in medicine, we've seen a lot.
We're discussing key issues surrounding health and wellness, answering some of our biggest questions, overcoming health obstacles, and giving patient-centered advice in hopes of educating you and providing the tools you need to live a healthy life.
If you find our podcast helpful, please consider subscribing so you don't miss an episode. And don't forget to leave us a 5-star rating and review. This will help other people find our podcast.
Thanks for joining us. We look forward to serving you. Thank you so much for joining us today on Between Two White Coats. Amber and I say we're excited about every single person that we have on, and
yes,
we are excited, and we have a lot of great friends and very intelligent people who are kind enough to join us. But today we have extra
We're super excited
because we have Michael Bruner, who is one of our nurse practitioners who works here at our Family Health Center with us, and we care deeply about Michael, and he's so well informed, and so I know you guys are going to enjoy hearing from Michael. And the topic that we're going to do today is men's health, and really trying to reach out to men and help them be able to take better care of themselves. And Amber and I are smart enough to know that we are so annoyed when a bunch of men sit around and talk about what's right for women. So we were not about to make that mistake and be two women sitting around and talking about what's right for men. So before we get started, Michael, if you would introduce yourself, tell us a little bit about your history and
your family.
Yep.
Yeah. So first of all, thank you for letting me come on.
You didn't have a choice, Michael. You work with us.
That's true.
Like that was it.
We would have tormented you until you gave it.
I got voluntold.
Exactly.
But no, so I've been a nurse practitioner for about 3 years. First couple were in the ER. Background is ER, emergency medicine. I was an ER nurse for about 10 years. So moved over to family medicine here about 1.5 years ago, and have loved it ever since. I always joke my worst day here is nowhere near as bad as my worst day in the ER. So just very, very thankful. Family, we have 2 kids. My wife and I have been married for about 11 years, actually next week. So 2 kids, 8 and 7. We were talking about baseball before we got started. So ballet, just busy. So
yeah, Michael's the baseball coach.
Yeah.
And a winning season.
Doing really
make
well,
sure
yeah.
we know that.
Yes, the winningest baseball coach in the Little League.
7 and 8 year old, big deal. So.
Pretty sure this is going on special skills in your resume now, right?
Yeah, absolutely. So.
And we so enjoy your family. And if any of you have listened to one of our first podcasts, had Becky, and Becky was brave to come on and tell her story as one of our patients, and that's Michael's wife, and they are a wonderful family. We really appreciate them. The reason that this episode came up is Michael and I were talking one time about some of the things we're doing in our wellness center and our extension of primary care. And Michael was talking about wanting to lead some programs for men where we could really help address some of the things that we feel like would help better lead men into areas of better health. The bottom line is really that we don't think that men are very aggressive about their health. Women sort of have a different experience. Women are taken to the doctor early because we have different things that happen that it's like, oh, you got to see the doctor for this, that, and the
or
other.
even childbearing. Like it's like
yes.
You just are kind of expected to go to the GYN, like, go get your pap smear, you're going to have a baby. So you go all the time. Like, yeah. Especially in those younger ages, so you establish at least a pattern of seeing someone, usually yearly, younger. So men don't have pap smears. So it's not like they're going.
Yes. And
right, Michael?
No, last time I checked, no.
Yes, right. We did not necessarily need your expertise for that part. But yes, I think women tend to maintain, like you do your kids, your pediatric visits, and then you go off to college or you start your life, and some people just kind of fall off from healthcare, and women tend to not do that as much. And then women get pregnant, and then they have a lot of healthcare, and sometimes they, are frequently seeing their OB-GYNs and might not have a primary care, but they're
being
getting
seen.
care, they're
Yeah.
being seen, they're being well taken care of. And so we frequently will ask new patients who are men, what woman in your life made you come?
Who made this appointment?
True,
yeah.
They usually show up at the first appointment. I always tell my guys, I know you're doing well when your wife or significant other stops showing up. Like when she lets you come by yourself, we're probably doing okay. So.
Yes, right, because not only do they make you come, but they will come with you because they're afraid you're not going to talk about.
What's going on today? And it's nothing, I'm fine. Wife breaks out the list. And
right. So what is it that is keeping men? What are the barriers that we can help overcome that is keeping men from even being able to say, I have a doctor, I get my annual wellness, I do the things that I have to to make sure I'm being taken care
of? I think it's a few things. One, men, and not all men, I mean, I hate to generalize, but most men, I think, when you're in a situation and you don't feel like you're in control, or at least have some bit of control. So when you come in, a lot of guys, my brother's a perfect example. I just got him in here after he hasn't been to the doctor since he was like 13. He's an electrician, works in rock quarries, just a guy's guy, and he hates any kind of medical setting, and it's because he doesn't have the knowledge base. Guys think they're going to come in and get stuck with a needle, and so I think it's just fear or lack of control. So I think that's one thing. I think the other thing too is guys feel like, if you're dealing with something, whether it's a physical ailment or mental health or something like that, there's this kind of stigma where, guys, you're just supposed to suck it up and deal with it. Pull your bootstraps up, try harder, and so I think guys are way more hesitant to ask for help or seek help, when it comes to stuff like that.
Both of those are excellent points. I think when it comes to being in control and feeling, a little bit vulnerable, I believe it's less likely that men would wander into that area of being vulnerable. But I would definitely say that if you're in the right practice, that you don't lose any control. This is your life. These are your decisions, and we're actually going to allow you to have more control of your health because you'll be informed. And if you're sitting with the right person, and we say, here's your options. Here are the different things that we're seeing. What do you want to do? Right. What do you think is important? And a good primary care relationship should really be based on that. So I'm glad you say that, and I hope we can take away that thought for a lot of men that you are giving up any control or that you're having to make yourself really vulnerable. We're going to meet you where you are, and you're going to make the decisions. We're just going to help empower you so that you can do that. I think even when we talk about asking for help and being able to, again, kind of makes you a little bit vulnerable, but being able to say, I'm feeling this and I would like to figure out what it is, or this just isn't, I'm not living my best life. I think the suck it up thing is super real. And so it's like, I have these little symptoms, whatever. It's not, walk it off. Yeah. We don't have to walk off our diabetes. We can actually get that diagnosed and treated.
Right. Well, one of the first things I try to do with, especially younger guys, 20, 30, 40 years old, is empower them when they come in. Like, this is shared decision making. Like, you told me when I first started here, because I was going home, and kind of worrying about, did I make the right diagnosis? Did I treat this the right way and things? And you told me, I can only care about people's health as much as they do, which was huge. Like, it was just kind of this mind-blowing thought. And so when a guy comes in and I say, listen, I'm on your team. I'm never going to prescribe medication or tell you have to do something. I'm going to give you all the knowledge, all the resources, all the tools that I have, that we all have in this clinic. And ultimately what you do with them is your decision. So and just put them in the driver's seat, and usually that's somewhat comforting.
And we did an entire episode in the podcast on preventive recommendations for men at different ages, and I would definitely recommend that any man who's listening to this tap into that. But as long as you are seeing your doctor for your annual visits, the nurse practitioner doctor is going to lead you there and help you know what preventive stuff you need to be doing. And so really, if you're thinking, well, I haven't been to the doctor in a while, do I need to go? The answer is yes. Yeah. The answer is yes, because there are preventive things that we can help keep you from getting sick. And so you don't have to be sick to come and get care. We can keep you from getting sick, which is so much better. Yeah. And we can step you through, like, these are the preventive things you should be doing. You have a high family risk of this, or there are other risk factors, so how can we help make sure you don't get sick? But then let's go into the people who are kind of denying that they may have stuff. I think it is scary to think, like, I just don't feel as good as I think I should, or something isn't right here, and I'm a little afraid to hear, or I'm just going to ignore it. So those kind of people who might be like, I'm just not doing so well. What are some of the things that we see with men that they may ignore too long?
Well, I think it goes back to what you just said. Preventative measures help prevent problems. So yeah, I don't wait for my truck to have an issue before I take it in and get the oil changed, get the tires rotated, things like that. So I definitely think preventative screenings and preventative care, you can kind of mitigate some of those issues that can come up.
Absolutely. So we want to encourage everybody to come once a year and have an annual wellness, no matter what age you are.
Even if you're voluntold.
Even
That's
if you're
right.
voluntold, even if you're male. Yes, all of the above. And then let's talk about some of the things that we in our careers have seen or that you've experienced with friends and family, that people wait too long before, or it's uncomfortable and we see that people aren't getting the care that they need. And one thing that I think across the board, doesn't matter what gender you are, is mental health issues. But I do think that there's this extra stigma and barrier to care for men when they're just not feeling their best mentally, like maybe feeling down. I like to say that depression plus testosterone equals pissed off.
Yeah.
It's not so much crying. It's not so much
irritability.
feeling sad and withdrawn. Like we picture females and depression and we think that's depression. It's irritability. It's road rage. It's short temper with the kids in the evening, just feeling like you can't connect or love people like you want to. And I think sometimes that's hard for men to identify that their depression may present different. But let's talk about mental health stuff in general with men.
I think that's definitely one of the things that they'll put off. Chest pain and things like that, you can probably get them in the office after a while. Mental health, and again, in general, I find that most men don't want to sit down and talk about how they feel. And this one actually hits home with me because, there's a lot that goes into depression as far as neurotransmitters and hormones and all kinds of things that can go wrong. But I was on an antidepressant or several over the course of about 8 or 9 years. And mine ended up being really low testosterone, so I fixed that. And there's still days I struggle with, feeling overwhelmed or feeling, inadequate and things like that. But I definitely think, for men to perform their best in the workplace and in the house, as a father and a husband, mental health has got to be one of the first things that you've got squared away, because it's going to bleed into every other aspect in your life.
Well, and you want to feel good. You want to love people well, and you don't want to be irritable and testosterone ragey, because that's not who most people want to be.
Yeah.
Most people do want to be loving and kind and not feel so on edge.
Yeah.
Yeah.
When I think there's a saying I like, and I've got a bunch of these because we talked about them, but
I like them.
One of the ones I like, because I'm very much into the SEAL community and military and those type of things. But one of the guys that I was listening to recently talked about a savage servant. Which will resonate with men, because men like to be seen as strong, most men like to be seen as strong and protective, and those things. And so when you throw the servant piece in there, when I go home, I'm not looking to go home and upend and make everybody in my house uncomfortable and things. My wife needs to know she's loved, protected. My kids need to know Dad's home, it's time to have fun, it's safe, it's playtime. And so I definitely think mental health is a huge space where, some progress and things could be made.
Yeah, I appreciate you sharing your personal story with that, because I think that we grossly underestimate the number of men who are struggling with depression, anxiety, stress management. There's a lot of things that we have to shoulder, and I think a lot of men really take the responsibility for the wellness of their family, the financial health of their family, and that's a lot to shoulder. And so even if you're just feeling like it's a lot of stress, or you're noticing small things like you're a little more snappy, short-tempered, you really take it personal when someone cuts in front of you on the road. It's not personal, they don't know you, they're just a bad driver. But I think these are little triggers that we can start to recognize. I think if someone who cares about you is saying things like, you're not yourself, you're not acting, you're not spending time with the kids, you're withdrawing.
Did you talk to my wife before?
Yeah, actually, no. But it's super common, and I think a lot of times men will sort of pull into their cave, just withdraw a little bit. And these are indications that it's time to have a conversation with someone. It doesn't mean that we're going to tag you with some diagnosis or force anything on you. It means that we're going to help you get to your best life and allow you to really appreciate the things and enjoy the things that you're trying to enjoy. And it is heartbreaking to us, and we've talked about this in our episodes on mental health, that it is so hard to be able to ask for these things. But I think the more that all of us who struggle with these type of things can talk about it openly, the more we can normalize it. This is not rare.
No, and when I sit with patients and, we've had these conversations and their wife comes with them initially and we get to a place where they feel better, they're very thankful. They see the benefit of it. And then, like you said, they don't come with their wife anymore. Like I tell them, we've been together a long time now. Like, and your wife's not coming with you and you're coming by yourself, because they do feel so much better. So I think that the end result is it's worth it.
Absolutely.
Yeah, it's worth it.
Yeah. I like to joke to my husband when he has spent time with people that we've been friends with forever and he's done like a guy's weekend or something, and which I hugely support. I think we need to have our community and we need to have the other guys that are supporting you in life. But he'll come back and I'll say, okay, so what's going on with their wife? What grades are their kids getting?
All the details.
What's the extracurriculars that their sons are in? And he's like, we watched football.
Yeah.
And so it's, it's not to say that men and women don't connect very differently. However, there is that necessary connection in life. And so I think sometimes if you're feeling disconnected, now if you sit and talk about all the pro athletes and you feel connected, awesome. That's good. You're doing well. Yeah. But if you're feeling disconnected or you're feeling like you need to have some of these other conversations, I think, your primary care is the right person to start with and talk about these things.
Yeah. Well, and I would add counseling. And this is just going to be a shameless plug for counseling. That was another huge part or process of getting through some of the stuff I went through. And again, fixing the hormonal issue, that was a huge piece. My energy level and everything got a lot better. And I was able to stop the antidepressants and things. But again, counseling, because I had stuff, my parents got divorced 10, 12 years ago. So there was some stuff, but I had a really good childhood. I have a great job. My kids, there's not a reason.
We appreciate that you said you had a great job.
I do.
You like that.
I do. I like everybody I work with too. So getting that hormonal issue addressed, and then went back to counseling and had to deal with some of the stuff that I didn't realize, was maybe unprocessed grief or anger or bitterness. And again, those are things that guys are not going to want to talk about.
Right.
I cannot explain to you, even after I'd say 3 months of just sitting and talking. So finding somebody you can talk to, whether it's your primary care provider and that's one of the first things I give my patients is, we can talk about medications because we are quick to throw, I always say a pill at every ill. But counseling is huge when it comes to this stuff.
Yeah, 100%. We couldn't agree more. And it's just a safe place to be able to sort through things. You've mentioned low testosterone level and something that we all diagnose and treat a lot, something that you have really helped many people with, but have experienced yourself. Talk about the different things that people might be thinking, maybe I want to get a testosterone level tested.
Well, and so mine was, I was 26, 27 years old, had been an ER nurse for a while, so was working all kinds of crazy hours, somewhat of a stressful job. And I was just tired all the time. Didn't matter how much I slept. I'd get home from work. Didn't matter if it was 7 a.m., 7 p.m., and just wanted to go to bed. I was withdrawn. So some of the stuff you were talking about, I didn't want to hang out with my wife. Didn't want to hang out with my kids. I was a newlywed at the time. Didn't care anything about sex. So those are all kind of the big tip-offs to maybe there's an issue with my testosterone levels. Not super common, especially in, I've had patients come in, because again, I was 26, there's not a really good reason for a 26-year-old's testosterone not to be, normal.
Well, except that you did mention a few pretty good reasons, when we have taken people's body out of the normal cycle, so you're working nights, and that starts to create endocrine backlash of, hey, you're supposed to be asleep right now and you're not, so now I'm making some stress hormones. And then when you work nights, you come home and you sleep for 4 hours and you act like it's a full night's sleep because everyone else is up and you need to be doing stuff. And so there are a number of things, whether it's stress, you're working in the ER, people are dying in front of you, and you're trying to process through all of this. And so whether it's stress, whether it's night shift, whether it's other, hormone changes that people can have, however, it could be really easy to miss that. And it's really a blessing that you caught that in your 20s, because most people in their 20s were not going to think test the testosterone level. But it can look like depression. It can cause depression.
Yeah.
And I think, treating it as depression at the same time is a good idea, because let's just address everything until you feel better, and then we can start pulling things back. And then as we age, there's some conversation about menopause and is there menopause, and we've talked about this in the past. But, you know, in 40s, 50s, 60s, hormones change. It doesn't matter whether you're a female or a male, your hormones are going to change. And so I think as those same symptoms, as men are in their 40s or 50s and they're noticing complete change in their sex drive, complete change, and it doesn't have to be all these things. It could be just, you know, some little collection of it. Right. Complete change in energy, feeling maybe depressed or withdrawn or lack of interest in doing things, loss of muscle mass, gaining weight. Yep. You know, a lot of these things warrants looking at a testosterone level. And so we've certainly taken into testing testosterone levels as a workup for fatigue, a workup for a number of these other symptoms, because it's only after we recognize what's going on there that we can treat it, and it's not a hard treatment.
Yeah, well, that was because you said, you know, it took me 3 different providers, you know, not that the first couple did anything wrong, but I got worked up for anemias, you know, B12 and folate levels, had a sleep study, you know, all these other things that I guess statistically are more likely, but then it took one brilliant PA to sit down and talk to me, and it was really the sex thing that she was like, you know, you're 26, that's not normal. Right. And so like I said, when I started on hormone replacement therapy, it was a world of difference. You know, now I had energy to go home and hang out with my wife and kids and wanted to, and I wasn't irritable and withdrawn.
Felt like your normal self again.
So
yeah.
I think that's excellent. That's a lab draw. So, you know, if you're doing a preventative health screening and you're concerned, you know, it depends on insurance coverage as far as the testing, but it's not a very expensive test at all to self-pay, even if you just wanted to know. And so for me as a provider, I'm like, well, yes, I can add that. That's an easy add-on lab. I'm not doing anything additional besides typing in an additional word.
Yeah, and I have very low threshold for doing that because testosterone levels are a huge range. And so what's normal for one person may not be normal for someone else, and seeing those trends is sometimes helpful if people are having symptoms as well.
Yeah.
So Michael, in really looking at, we're trying to encourage men to make sure they're taking care of themselves, period. You know, whatever that looks like, let's make sure we're taking care of yourself. What advice would you want to offer people?
So when I have a guy who is, you know, comes in and is kind of hesitant, or, you know, has been kind of put off by doctors in the past and things, telling him, you know, hey, you need to do this, this, and this. First of all, find a provider that'll listen. You know, it's going to sit down and have a conversation with you. It's going to be, you know, involved in and supportive in your decision making. And then the second one is, you know, just being honest. You know, don't come to the office and muster up the courage to come in the office and say, no, I'm fine. You know, and it's okay to, whether it's, you know, your blood pressure, your blood sugar, your mental health, again, because I can only advocate and run with the information that you give me. So just, you know, find your provider that will sit down and have a conversation with you. And again, you know, when it comes to the why, because that's something I found with guys that works really well. They've got kids, so I have a 7-year-old daughter. You know, if you want to, what I'll use with my guys is, you know, if you want to walk her down the aisle one day, you know, or if you want to be a good man, part of that is taking care of yourself. And so mental health and your physical health is a huge part of that.
I love everything that you're saying. I do think that we have to remind people that just because you've had one bad experience with someone doesn't mean, you know, if you had a bad coach, if you had a bad mechanic, you don't, you know, never do that again. So, you know, just keep shopping until you find someone that you connect well with. And
I've told people in the past, if it's not me, I'm fine with that. You know, if you get out and you're doing well and happy and healthy and things, I don't care where you go. My boss may not like that answer.
No, there are people who will connect with us, and it's important that those are the people who find us. And if there's not a connection, we want you to be with someone who you have that connection with, that you can trust.
I can make that joke because we know your heart and how much you care for people.
That's right. That's right. So I think that's so important to remember, and I also think it's really important for men to realize that this is just a normal, natural thing that you need to do. You need to have a medical provider. You need to be having certain labs done and checked. But most importantly, when you're not completely living your best life, when you don't feel right, don't walk it off. Don't try to ignore it. The fact is that there are people who want to help you, and we encourage you to reach out and make sure you get that help.
Absolutely.
Thank you, Michael, so much for being with us. You did such a great job, so we're going to keep trying to recruit Michael back, guys. Stay tuned for more Michael.
We like to leave you on a good note, so here's today's Tell Me Something Good. Time together in the car. If you have loved ones, children that you are responsible for getting from here to there, Being in the car seems like a never-ending task, but I have really enjoyed spending time with my children in the car. It's something that I get to do instead I have to do. We often will pray together, sing songs, trash talk, all of those things, and it's something good. It ends up being some of my favorite times of the day. So hopefully you will enjoy your time together in the car with your family. Thank you for joining us, and until next time, take care of yourself.